This is my PSA on Kava, the untold risks. So what is Kava? Kava is a psychoactive drug that originates from the South Pacific Islands. It is traditionally used in Pacific Island culture such as Polynesian, Philasian, and Hawaiian. Kava is used in ceremonies, religious, and cultural practices as it carries the ability to help communicate with spirits and strengthen ties within their culture. Kava was first introduced to Australia as many people from Pacific Island cultures settled into the country. It was seen and offered as alternative alcohol as it carries many of the same sedative and relaxative effects. The issue came when people began to stray away from traditional uses and started to use it recreationally. After its introduction to Australia, the use rate saw massive growth and the government began to take notice. With issues increasing of overuse, in 2007 it was banned besides medical use. Kava ran into issues with abuse as people take higher doses or mix it with other substances, moving away from something spiritual or cultural into a recreational use where we see negative health effects. This happens with many drugs as people begin to mix it or move away from what it was meant to be, and it becomes a negative drug. Kava can be mixed with alcohol, pills, and narcotics to decrease its effectiveness, but that only leads to dangerous results. So how does kava work? Kava is typically made by grinding the root of the shrub and soaking in water to create a drink that offers psychoactive effects. Kava chemicals are fat soluble, so it is absorbed quickly into the body and reaches the brain effectively and efficiently. It is broken down by the liver enzymes and leaves the body through urine, which is why it has such a large effect on the body's liver. Kava works by affecting a neurotransmitter in the brain called GABA, as kava contains a compound called kavatones. GABA receptors control our body's feelings of relaxation and calmness. Kavatones causes GABA receptors to work at an increased rate and cause feelings of relaxation and sleepiness. These compounds within kava also inhibit sodium and calcium channels, which lead to a psychedelic nature and more relaxing effects. Kava takes effect on key parts of the brain, such as the amygdala, hippocampus, and prefrontal cortex. The amygdala controls our emotions, and by reducing activity in that region, it can reduce anxiety and promote feelings of relaxation. It also affects the hippocampus, which is responsible for learning and memory, which is why many feel brain fog or forgetful when taking kava. The prefrontal cortex is responsible for making decisions, which is affected by kava. Many people find it hard to focus or control their impulses. Kava has been shown to have some effect on dopamine and serotonin levels, but that is not the main effect of the drug. So when we look at kava symptoms, many people feel relaxation, calmness, euphoria, and muscle relaxation. But when we look at the long-term effects of kava, we see liver damage, dry and scaly skin known as kava dermotherapy, and then we see digestive and emotional and mental health issues. we see such harsh as we see such harsh damage on the liver, as I said before, because it's processed through the liver. And then this is why mixing with other drugs also causes so much stress on the liver. We see a lot of liver failure as well. And then for kava therapy, the result and the reason it happens is still not exactly known, but is believed to be believed to be caused by interference with cholesterol metabolism. In the short term things, we just, as I explained, know that comes from the GABA receptors and the effect that the kavatones have on it. So the first body system that I'm going to be looking at for kava is the musculoskeletal system. The musculoskeletal system is the body's framework, which consists of bones, joints, cartilage, and ligaments and muscles. It allows the body to move and protects our vital organs. Kava doesn't directly affect our bones, but it can indirectly affect them by how our muscles interact with it. Kava relaxes our muscles so it can affect your movement, making you less stable or having an increased risk of falling. The muscular system works with our skeletal system to control how we move. Our muscles react based on signals that come from our brain. Kava relaxes the muscles and slows these signals that come from our brain, and this causes people to feel weaker or slower and in trouble controlling their body, because these signals that tell our muscles to contract are being affected by kava, and people will lose these motor controls of their body. The next body system we're talking about is the integumentary system. And the integumentary system is our body's outermost layer, and this is your hair, your skin, and your nails. Its main role is to regulate our body and protect our internal organs from outside threats. This system is affected most by kava, as long-term abuse causes a condition called kava dermotherapy. This condition causes your skin to become scaly and dry and rough, as I said before, and the cause is from interference with cholesterol metabolism, scientists believe. And if we look here, these are a few pictures of Kava dermotherapy. You can see the scaly, dry skin. Yeah, just really a terrible side effect from Kava that many people don't know about and is very untalked about. And then let's look at some real abuse cases. A 56-year-old Australian woman developed fatigue and nausea and jaundice after taking Kava as a supplement for anxiety. Her liver rapidly began to fail, and then when she stopped the supplement, she required a transplant, but died during surgery due to uncontrollable bleeding. The liver failure was not from common causes, but showed damage to her tissues and organs from the use of Kava. And then we also see a 22-year-old woman started to feel sick, and she had nausea, and she was tired, and this is after taking Kava for a few months. She later developed jaundice, and her liver got worse even after she stopped taking Kava, and she needed a liver transplant to survive. Although she recovered, she died 6 months later from a serious infection in multiple organs. So as we can see, there's Kava dermotherapy and there's liver failure. Two major things that come from taking Kava, and these are real things that happen and real side effects from taking this drug. And now if we look at the DEA and regulations, the DEA does not have Kava as a scheduled drug in the U.S., so it's not seen as a controlled substance. Many other countries do, like the UK and Australia, do have restrictions or bans on them just because of its liver toxicity and the health issues it brings, and is more prominent in those areas. It is also sold as a supplement, but is not very regulated like many other supplements. But many people do take it as a muscle relaxer is the most common. It is not highly addictive, but there are many warnings out there based on the potential side effects for your liver and your skin. So overall, Kava has massive cultural significance for the island cultures that it came from, and treatment for many health conditions and like anxiety and muscle relaxation. But like anything, the drug does have its side effects, and when it is abused and overused and mixed with other drugs, we see these terrible things like these two women who died from liver failure, and these also terrible skin conditions like Kava dermotherapy. That is my PSA on Kava, and these are my references. Thank you for watching.